Welcome to the Sentinel site training for the enhanced antenatal HIV Sentinel survey being conducted in South Africa in 2025. We will start with an overview of the study, including background, objectives, study design, results from previous survey, and the key stakeholders. As we know, South Africa has the largest and highest profile HIV epidemic in the world. Nationally, an estimated 7.7 million people were living with HIV as of the end of 2023, of which 4.9 million were women in the age group 15 years and above. HIV surveillance data provides key strategic information for effective and focused response to HIV. In the past decades, the antenatal HIV sentinel surveillance, the ANCHSS, has been used to provide valuable information for national prevalence estimates, epidemic monitoring, and program planning. Pregnant women are generally representative of the sexually active adult population and are easily accessible during antenatal visits. This enables surveillance activities to be performed regularly, so every 1 to 3 years, using cost-effective and feasible methods. In South Africa, the antenatal surveillance has been used to monitor the HIV epidemic since 1990. The main objectives of the study include HIV prevalence and incidence, which is assessed at a national, provincial, and district level and aggregated by age and genotype. Progress towards the 95-95-95 targets, so 95% of people knowing their HIV status, 95% of those being on ARVs, and 95% of those being virologically suppressed. Also assesses the coverage of viral load monitoring during pregnancy, proportion of infants at high risk of mother-to-child transmission, which means the mother has a viral load of greater than 1,000 copies per ml, proportion of recent HIV infection, so that's the new infections within the last year, syphilis coverage and coverage of syphilis treatment, hepatitis B seroprevalence, SARS-CoV-2 seroprevalence, looking at immunity from past natural infection as well as vaccination, PrEP and DREAMS coverage, and lastly, agreement of HIV results between clinic-based rapid tests and laboratory-based enzyme immunoassays. The study design is a cross-sectional survey. That means that it is a snapshot in time. We do not follow up with the women again. We only sample them at one time point. The study aims to enroll 36,015 pregnant women in the age category of 15 to 49 years old. By this we mean fully completed and enrolled surveys. This number excludes refusals. There are 1,589 sites across the country that will be taking part in the survey. This is split up between the different provinces, each province of which has got a different target. The study starts on the 17th of June and will end on the 25th of July. During this 6-week period, all enrollments need to be concluded. The report from the 2022 survey was released in January of 2024 and is publicly available. The results show that prevalence is decreasing. From the graph below, we can see from the start of the survey in the 1990s, we saw a sharp increase in prevalence. This plateaued around 2005, and we see now as of 2019 and then in 2022, we see the decreasing prevalence of HIV in South Africa. We'll have a look at the key stakeholders involved in the study. First up, we have the project management team. This includes the NICD, or National Institute for Communicable Diseases, who are the principal investigators, and Genesis Analytics. At the NICD, the team is headed up by Prof. Adrian Purin, who is the overall principal investigator, Dr. Tendasai and Dr. Nozipo, who are co-investigators who are covering the epidemiology of the project, and Ivaldi and Beverly from the lab, who will be conducting the lab testing. They've been involved in developing and reviewing the study protocol in collaboration with the different stakeholders. They provide the general oversight for the implementation of the survey. They will also be leading the team who will be analyzing the findings and dissemination of the report. They work closely with us at ANCHSS with regards to preparing the materials, the training information, the data collection processes, monitoring and supervision. And lastly, they oversee quality assurance and testing procedures. At Genesis Analytics, the team is headed up by myself, Dr. Sue Aitken. I'm the project director, and I'm joined by my colleagues Kim and Elzette, who are data managers who will help with the data processes, and Ariana, who is our project coordinator and will be one of your main points of contact throughout the study, and Ashley, who is a project analyst who will be part of the data cleaning team. For this iteration of the study, we will be the main point of contact and will be assisting you with any queries or challenges you may have. We've been part of the team developing all the materials in the format that you will have received in the kitted boxes, and we've prepared all of the training materials. We have been going through a series of conducting training, culminating with this training video. By now, you should have received your kitted boxes, and we have been overseeing the logistics for this, as well as collecting the data on those who have attended the trainings. We will be monitoring the receipt of the samples and providing you feedback on the progress for each site. We will then be managing the survey database with all the information that we have captured from the survey data forms. We'll also be doing general monitoring and quality control during the study. We also have the survey coordinators who are based in the provinces. This includes provincial, district, and sub-district coordinators. The provincial coordinators are ensuring that they understand the protocol fully and make sure it is implemented as desired. They've been helping us coordinate with the training, so we have been providing live trainings as well as providing the training materials to be disseminated to the districts and the health facilities. We've been liaising with the coordinators to ensure that the kits are being distributed to the correct people and onward distributed to the clinics. They will be also providing oversight to ensure that the study is being implemented as desired, as well as the targets are being met at each facility. They will be assisting us with monitoring the study progress, and this will be done through regular communication between ourselves as well as the other study survey coordinators within the districts and sub-districts. From a district and sub-district perspective, the coordinators are ensuring that training has been conducted in their areas, that the kits have been received, that there is oversight at the clinics, and providing any technical support needed at the facilities. Where needed, we will be reaching out to get assistance with site visits where there are concerns at a site, and we will also be having general communication with all role players to ensure that everything is being kept up to date. The health facilities are the most important key stakeholder in our list, as this is where the survey itself will be conducted. At each health facility, we'll have a site champion who will ensure that they understand the study completely and are able to provide the assistance to their team on site. They will make sure that confidentiality is being maintained and that survey forms are being completed as needed and samples are being couriered to the NHLS laboratories in a timely manner. The antenatal nurses will be our most important stakeholders, as they will be the ones engaging with the clients to enroll them in participating in the study. Their role is to ensure that they recruit eligible participants, obtain consent from each participant, complete the data collection forms, and collect the required specimens. After this, making sure they are packaged correctly and ready for the courier. Once the samples have left the sites, they will make their way to the NHLS laboratories. We have NHLS hub labs who will be the ones receiving the samples and shipping them to the NICD. Along the way, there will be couriers who are employed by the NHLS who will be receiving the samples, taking them to intermediary labs. Intermediary labs have been briefed about the survey, and there are addresses on each sample indicating which hub lab the samples need to be on-sent to. And when they arrive at the hub lab, the NHLS personnel will help with receiving the samples, keeping them refrigerated until shipment, preparing shipments of the samples to the NICD, and we will also be having routine communication with them to ensure that all the study procedures are on track. At the NICD, which is also part of the NHLS, we have data clerks who will be assisting with the study as it is conducted. They will assist with sample receipt. They will check the samples match the survey forms. They will conduct initial QC for completeness and consistency. And if they are noticing any issues that are coming from the site, they will escalate these to the data team. They will be assisting with centrifugation of the samples and also scanning the survey forms into the database. We'll now look at the procedures, so the survey steps and the study supplies. There are 10 main steps involved in the survey. The first is to screen women for eligibility criteria, introduce the survey to the eligible woman and invite her to participate. You will then collect the baseline information, provide and explain the information sheet regarding the survey, obtain informed consent to take part in the survey and for the specimen storage. Next, we will conduct the survey, which includes interviewing the participant and completing the survey form. Following this, there will be the blood sample collection, packaging of the survey and blood specimen, or survey alone for refusals, registering the participant name and contact details in the clinical logbook, which is a separate register in case we need to return results, and lastly, shipping the participant packs to the designated NHLS laboratory. In order to conduct the survey, we have provided you with kitted boxes, and each box contains everything you will need for a survey enrollment. The kitted boxes are specific to your site, and you'll notice that the documents, such as the survey form and the clinical logbook, will have your site name on it. Please ensure that when you receive it, that you have received the correct site. You cannot share the documents with other sites, otherwise they will be enrolling under your site name and getting the credit. This, of course, will also disrupt the epidemiological work as we are looking at specific targets per site. When you receive the box, please use the WhatsApp hotline number to let us know that you have received the box. This can include your name, facility code or facility name, and received. Districts will also be supplied with some spares in case any site does run out. So let's look at the main components of the kit. So there are 10 items. The first is the survey form. This is a form pad including 50 survey forms. This is the smallest unit that the form comes in. So if you receive a pad with 50 forms, this does not mean that your target is 50. So please do not necessarily use all 50 forms. You'll see on the front of the form, we have the enrollment and consent questions, and at the bottom there are barcodes, and the back of the form is the main survey. We've also provided a job aid poster. This is a single document. This can be put up in the nurse's room to give quick and easy access to the study steps. In each kit, there is a pack of information sheets. Again, these are in a pack of 50. If your site has a large number for target, you'll get multiple packs, and these information sheets will be distributed to the participants. We have also provided you with a clinical logbook. We'll look at the logbook later, but these are specific to your site, so please ensure that it is correct for your site. We then have the phlebotomy consumables. This includes phlebotomy needles in a box of 100. PPT tubes, which are plasma preparation tubes. They are essentially EDTA tubes with a gel plug that assists with centrifugation. There are 50 in a pack. Alcohol swabs come in a pack of 200. The specimen bags come in packs of 25. And we also have the green labels. These are the labels to be placed on the outside of the specimen bag, and they indicate which NHLS hub lab the samples need to be sent to. These come in a roll of 100. We have also provided you with courier bags, which are large Ziploc bags that you can place all specimen bags together into to keep all of your specimens together. We will now look at the enrollment processes, including eligibility criteria, informed consent, introducing the survey, the information sheet, the survey form, what to do with refusals and re-enrollments, basics on the sample handling, courier to the laboratory, participant tracking, and reaching target. So the eligibility criteria for the survey is who should be enrolled, so that means they are eligible. As this is an antenatal survey, the woman does need to be pregnant. We are specifically looking at women aged 15 to 49 years. They must be attending the antenatal clinic. The visit type is not important, so any visit is eligible. We are including HIV positive women. We are including HIV negative women. We are also including women who do not know their HIV status. So the HIV status is not important for enrollment. We will look at all HIV statuses. So that's positive, negative, or unknown. Who should not be enrolled? In other words, they are ineligible. Anyone who is younger than 15 years of age, anyone that is older 49 years of age, anyone that is not pregnant, and anyone that has already participated in the 2025 survey. So we cannot re-enroll people. Before enrolling a participant, we need to go through the process of informed consent. The research protocol has been reviewed and approved by a research ethics review committee at the University of the Witwatersrand. The research being conducted must comply with the agreed regulations and guidelines, which includes the Declaration of Helsinki, ANCHSS25, Ethics in Health Research, as well as South African GCP. Complying with the agreed regulations and guidelines for research ethics means that research participants are not harmed and neither are their family members. Their rights are put before the needs of science, and they do not have their right to choose taken away from them by the researchers. Informed consent protects the participants' rights by ensuring that they are aware of every step of the study process in which they are being asked to participate, and that participation is completely voluntary. Furthermore, participants should be made fully aware that they can withdraw at any point without having to provide a reason and without fear of reprisal. The informed consent process starts with introducing the survey. Make sure that you have read and understand the information sheet well so that you can address any questions asked about what is stated. Participation in the study is voluntary, and as such you need to provide the eligible woman sufficient information for her to determine whether she would like to take part in the survey. If the woman meets the eligibility criteria, invite her to participate in the survey. Below is an example of how to start the conversation. Hello, I am, provide your name. I am a nurse working in the antenatal care unit of this clinic. I would like to find out if you are willing to participate in a study called the Antenatal Survey. This study is being supported by the National Institute of Communicable Diseases and the National Department of Health. Explaining the survey to eligible women can be done in a group setting, for example in the waiting room whilst mothers are waiting for their appointments. This can include going through the information sheet itself. However, if they agree to participate in the survey, the interview itself and sample collection will be done in private. The information sheet has two sections. The first section is one page, which is double-sided, and it covers participation in the main survey itself. So that is the antenatal survey. There are different components to the information sheet. The first is why and how are we doing the study? This section provides an overview of the study and the importance. It includes the interview and blood sample, and it describes the processes that will be followed. Being part of the study and stopping the study. This section provides additional information on the process. It explains that participants can withdraw at any point and explains that participation is voluntary. Returning of test results. This section explains that contact details will be collected in case results need to be returned. It explains that the circumstances when results might be returned and explains the process of returning the results and explains the process if additional testing may be required. Under privacy, this section explains that a unique number will be assigned to the participant and the names will not be included with the answers themselves. It explains that audits might be conducted on the data and that the personal medical information will be kept confidential. It explains that HIV test results will not be shared with anyone other than the participant. Potential benefits explains that the main benefit is knowing one's status. Potential harm explains that there may be some extra time required in taking part in the survey, up to 15 minutes of longer appointment. Explains that taking blood might cause some discomfort, and explains that information will be kept private and confidential. Will you get any payment for being in the study? This shows and explains that no food or money will be provided for taking part in the survey, but also that there is no cost to taking part in the survey. People doing the study provides the contact details for the research team, explains that the study has received approval from the WITS Human Research Ethics Committee, or HREC, and provides contact details for the WITS HREC. There is also a one-page information sheet that covers the storage of study specimens. So during the study, a blood specimen will be taken, and after testing there may be some remaining specimen. This information sheet covers the request for participants to give permission for this remaining sample to be used in future studies, which requires it to be stored after the antenatal survey. The introduction explains why the participant is being requested to provide consent for sample storage. What the remaining sample will be used for explains the specific use is currently not yet known, and it depends if a new research question comes up later, and that this additional research will be conducted only with the approval of the Human Research Ethics Committee at WITS. Confidentiality explains that samples are only stored with a unique number and no name or contact details will be included. Where will my sample be stored? Explains that the samples will be stored in a secure location at the NICD that is only accessible to authorized staff members. It also explains that future use again will only be conducted if there is HREC approval. How long will you keep my samples? Explains storage is for 5 years, and this may be extended for another 5 years pending HREC approval. Does storage of my samples benefit me? Explains that there is no direct benefit, and the only benefit is related to learning more about HIV, which can benefit society. What are the risks? Explains that there are no risks as samples are anonymous and the samples won't be sold. What are my rights? Explains that sample storage is voluntary and consent can be withdrawn at any point. It also explains that withdrawing consent will not impact care received at the clinic. Future questions or concerns again provides the contact details for the research team. We will now look at the survey form. As mentioned earlier, this is a single A4 with a double-sided print. On the front, we have general questions about enrollment, the consent. At the bottom, there are stickers which are used for the sample. And on the back is the main survey itself. The interview process overview. As mentioned, that introducing the study itself and going through the information sheet can be done in a group setting, such as the waiting room. But it's just to remind you that the interview itself must be done in private, as there are some sensitive questions that are asked. The survey form is completed by conducting an interview of the participant, but also accessing information from medical records. The survey is conducted by the antenatal nurse, and it is currently in English, so it may require some interpretation into local languages. The process should take 30 to 45 minutes, with the information sheet taking the longest. If this is done in a group setting, this time can be greatly reduced. A reminder that women must be given the option to refuse to participate after they've been informed about the survey. Some tips and tricks about completing the survey form itself. Please use black pen. You can also use blue pen if that is what you have available, but please do not use a Koki, as this soaks through the page and can make marks on the other side. And do not use a pencil, as then the answers can be modified at any point. So it is a requirement to use a permanent solution, which is a pen. When completing the answer blocks, please use an X neatly placed within the box. The forms will be scanned by special scanners, and an X is the best way for the scanner to detect the mark. If you use a tick, the scanner may miss the mark. If you scratch out the answer, this will confuse the scanners. And if you circle around the answer, the scanner will not detect this. So please make sure you use an X in a box. If you do make a mistake and you answer 2 questions, please rather discard the form, as the scanner cannot tell the difference, and the data clerks who are reviewing the scans will not know which is the correct answer. There are also text fields, which includes numbers and text. We ask that you please write clearly, as these are manually captured in the system, and our data clerks need to be able to read it. So if you write with cursive, they may not be able to see what you have written and will not be able to capture the data. There is guidance for completing the survey on the inside cover of the form pads. So you'll see on the front cover it will have the antenatal name and the details, and when you open the form pad you will see the instructions for completing the form. The form is structured in 10 sections, and we'll go through each section now. On the front page at the top of the form is section A, which covers the facility details. The facility details are pre-printed on the survey forms. Please check that you are using the correct survey form for your facility. It is not possible to share books between the facilities. Do not write in anything in the space designated for the laboratory, as this will be covered up by their label. So here you can see that section on the right hand side. If the facility details are incorrect, you can contact the hotline and we will assist you. You will see that the facility details are underneath the barcode that is in the middle. This includes the facility name as well as the facility code. Please note that the facility code is an NHLS code. It is not the DHIS code. So if this code looks unfamiliar to you, do not worry, this is for laboratory use. The next section, section B, covers specimen information. This will only be completed if a specimen is collected. So if the participant refuses to participate, you will not be completing this section. This section is a record of the participant number associated with the eligible woman being invited to join the survey. This number is used to track the participant if they agree to take part in the survey, or to keep a record of the refusals if they choose to not take part. So we see in the green section there is a collection date. This is what needs to be completed. This is numerical values, so it will be a 0, 1, and then for the day, and depending on the month, for example June, is 06. The test code in the laboratory, for the laboratory is automatically selected. It does not require any additional indications. And a reminder that if a woman refuses to participate in the survey, they do not complete the collection date. You will see on the right we have the participant number, which is used as the identifier. And this will be used for both women who take part or refuse in the survey. This barcode is hard-coded onto the form and will match the barcode stickers that are at the bottom of the form. Section C is the survey enrollment questions, and this is collected for all eligible women. So that means they met the eligibility criteria, but may or may not participate in the survey. We will start with question 1, which is, are you pregnant? An X should be placed in the correct block. Of course, to be eligible, the woman does need to be pregnant. C2, how old are you in years? Please complete the 2 blocks there. Our team of data clerks will then complete the office use only section. This is to allow the scanners to scan the numbers. C3, what is your race? Options are given. C4, what is the relationship with the father of your child? Options given. And C5, is this your first antenatal clinic visit? Options are given. You will see that there are 4 options for this question, with the last option saying no, fourth or later visit. If, for example, this is a 7th visit, you would select this last option. Next, we move on to the consent. So the first consent in section D is for participating in the main survey, the current survey, the antenatal survey. This section needs to be completed for all women, including those who refuse. This is the record of whether they agree or refuse to participate. If the woman is unable to read or write, a witness needs to complete the witness section to confirm that the correct information according to the information sheet was provided to the woman regarding participation in the survey. So remember, this is only if a woman cannot read or write that we need a witness. If someone is able to read or write, they do not need a witness. The witness can also not be the nurse itself. So this is why it is often useful to conduct the information setting in a group setting, because you would have already had another woman who witnessed the process. So in order to indicate consent, in the blue section here, we will see 2 boxes. One says agree to participate and one says refuse to participate. It is required that for all eligible women, this needs to be completed. So either an X is placed in the agree to participate, or if they refuse, an X is placed in the refuse to participate block. It is also crucial that a participant signature is placed in the participant signature block. If the person is not able to write, they can at least put an X in the box to indicate that they agree with what was noted, so either agree or refuse. And consent is not complete if this signature is absent. So even if you indicate that they agree to participate, if there is no mark in the participant signature block, we cannot include it as consent. You also need to complete the date here, again numerical values. The second consent section is regarding the storage of the blood sample after testing. Remember that all women should be asked if they have agreed to participate. If they have refused to participate, there won't be a sample taken, so we no longer need to complete this section. Again, if the woman is unable to read or write, a witness needs to complete the witness section as evidence that they have witnessed that the woman was provided with the correct information. It is important to note that it is still possible to participate in the main study itself, but say that they do not want the sample to be stored. As the storage happens after the completion of the testing for the antenatal survey, it is okay that we do not store the sample should they not want us to. If they are taking part in the survey and you have offered them the participation in the storage, we will then complete the blue section where it says I agree to the use of blood specimens for future studies. So that means that their sample can be stored. One needs to indicate either an X in the box next to yes or an X in the box next to no. The participant again also needs to sign or make a mark in the signature block, and a date needs to be provided. If a witness witnesses, they must also sign in the witness block and provide the date. The last section is the nurse's co-signature. So this again is required to complete the consent process. The witness needs to acknowledge that they have gone through the consent process with the participant and that the information recorded is correct. This is completed for all women, including those who refuse. There is also a block to note the nurse's name. So please make sure that the nurse's name is printed clearly as it appears on the ID. The main reason this is important is that if we need to contact the nurse for whatever reason, including the return of discrepant results or any queries related to the completion of the survey form, we need to make sure we know who was responsible for completing the data. The nurse's signature needs to be placed in the signature box and the date needs to be indicated. This is the end of the front page of the form, and we now reflect where are we with this participant. So if she has agreed to participate, this means that the agree to participate box has got an X in it. If she has agreed to blood specimen storage, she has indicated an X next to the yes box and has signed the form. If necessary, a witness has also signed the form. And lastly, the antenatal nurse has printed their name and signed the form. If the eligible one does not agree to participate, that means the X next to the refuse box has been completed. The nurse has still printed their name and signed the form, and we also then end study procedures at this point. We do not ask any more questions and we do not take a blood specimen, and you just continue with the routine service provision to the participant. For those who agree to participate, we turn over the form and complete the survey questionnaire. Section F covers demographics as well as clinical information. F1 is the father of your baby 5 years or older than you. F2, has your partner attended any antenatal visits with you in this pregnancy? F5, what is your highest completed level of education? F4, how many times have you been pregnant, including this current pregnancy? So for F4, this can also include miscarriages and stillbirths. The difference with F5 is how many live babies have you delivered. F6 and F7 require accessing the medical records. Historically, these questions have been very poorly answered, so we ask that you please remember that when you start the interview that you have the medical records accessible to ensure that you can complete these immediately, and do not forget to get back to them after the participant has left. So please do complete these in real time. F6 is gestational age at today's visit, recorded in weeks, and F7 is the gestational age at first antenatal care booking, also in weeks. It is possible that if this is the first antenatal care booking, that these ages will be the same. Again, we see the office use only section. This is for the data clerks at the NICD to complete for the scanning. Section G covers the HIV status. This should be asked of all women. However, you'll see from question G3 to 5, this is participants who have been recorded as HIV positive to question G2. G1 asks, have you ever been tested for HIV before this pregnancy? And if yes, when? G2 asks, what is the participant's latest HIV status? Again, this maybe needs to be accessed from the medical records. If the answer is HIV positive, we then proceed to G3, which states, if HIV positive, when was she first diagnosed as being HIV positive? G4 asks, has the participant ever taken ARVs? And if yes, when did she start? And then lastly, G5, if taking ARVs, which ARV regimen is she taking? Again, this may need to come from the medical records, as not all participants will remember their regimen offhand. And a note that if G5, if a combination of lists of regimens are used, check all applicable options. For participants who are HIV positive, you will also then complete section H, which relates to the HIV viral load. There is only one question here, and this is asking if a viral load is documented what is the most recent viral load result from the test done during this pregnancy. So if the records are before the current pregnancy, they do not count. We only want to know for this pregnancy. Section I looks at the pre-exposure prophylaxis, or PrEP, and the knowledge thereof. So PrEP is a pill taken by HIV-negative women to reduce the risk of getting HIV. We asked this section for all women who have agreed to participate in the survey, so not only HIV-negative women. Question I1 asks, in the past 12 months, I had either more than one sexual partner or had only one sexual partner. I2 asks questions regarding these sexual partners. So it is important to know how to answer this when there are multiple partners. So the question asks, my current sexual partner or partners is or are HIV positive, HIV negative. They don't know his or their status. And of course, if there is no sexual partner, one can note don't have sexual partner. If the participant has more than one sexual partner, we will record as per the highest risk. So if they have 3 sexual partners and one partner is HIV positive, we will record the answer as HIV positive. If they have 3 partners and 2 are HIV negative and 1 don't know their status, we will then record it as don't know their status. However, if all 3 are HIV negative, then we will say HIV negative. So always remember the highest risk, which is in order of HIV positive, don't know their status, and lastly HIV negative. For I3, have you had sex under the influence of drugs or alcohol in the past 6 months? I4, have you had sexually transmitted disease in the last 6 months? I5, have you ever heard of PrEP before today? I6, have you been taking PrEP before this pregnancy? This mainly relates to participants who are HIV negative. If they have known to be HIV positive before the pregnancy, they would not meet this criteria, so you can note not applicable. I7, are you currently taking PrEP? Again, this would be applicable to someone who is HIV negative. If they are known to have HIV before this visit, one would then note not applicable, HIV positive. This year we have added some questions about the DREAMS program. The DREAMS program, which is funded by PEPFAR, is a multi-sectoral approach to prevent HIV/AIDS among adolescent girls and young women. So that is girls between the ages of 10 to 24 years and their male partners, aged 20 to 49 years of age in sub-Saharan Africa. It aims to reduce new HIV infections by addressing factors like gender-based violence, economic exclusion, and lack of access to education. Question I8 is completed for all women who agreed to participate in the survey and reads, have you ever enrolled in a DREAMS program? If the answer is yes, then you ask I9, which asks what services did you receive? The last section, section J, covers hepatitis B and syphilis. This section will be completed for all women who agree to participate in the survey. J1 asks, what type of syphilis test was done during this pregnancy? The question lists commonly available syphilis tests, including rapid or point-of-care tests, as well as laboratory-based tests. If the test that is on file is not covered in this list, you can indicate the type of test in the other section. There are 2 options for other sections because we know that it is not always one test that is done, so we give the option to note if there are 2 tests done. The first other section refers to point-of-care testing, which is indicated by other rapid, and the second other section refers to or allows for space for noting a laboratory-based test. J2, if syphilis test was done, what was the result? J3, if the result was positive, did the patient receive treatment for syphilis? And J4, was there a hepatitis B test done during this pregnancy? And if the answer is yes, then J5, what is the result? So this concludes the survey form. We will look what one does should you have a refusal. So if the participant refuses to participate, we then complete the enrollment questions at the beginning and note that it was a refusal. We do still need to capture this information, so you need to send these survey forms with your specimens to the lab. So you can either put the survey form in a specimen bag without a blood tube and send it that way, or you can include it in the courier bags or the Ziploc bags along with the specimen tubes. You will still complete the clinic logbook for the refusal, and you will send the documentation with the samples to the NHLS laboratory. If you have a re-enrollment, so this is someone who is visiting for the second time during the study period, we have specific instructions on what to do, but essentially you will not include this woman again. So if they were previously enrolled, that means they opted to participate and they completed a form. You need to confirm this either verbally or as evidenced by the barcode being placed on their file. If they confirm that they were part of the study, you do not offer to them again. So we would not fill in any documentation because this would be part of your eligibility screening. So remember, the eligibility screening is that they can't have taken part in the survey before. So if they have, we would not re-initiate them through the process. Another situation is that they may have visited the clinic during the study period and they were invited to join, however they refused. For them, we would have already completed a refusal form. So if we then include them as an enrollment, we will be duplicating this information. As such, we will not re-enroll them in the study if they have previously refused. So just a recap of the important points when completing the form. Make sure that you complete both sides of the form if the participant has agreed to participate. We need to ensure that all that information is present. So remember, where you've had to access the medical records, such as for the gestational age or the HIV treatment history or our load results, please make sure that you have checked the medical records and completed this information. Remember that we do not exclude women who are known to be HIV infected. We need to know this data as well. So all women, irrespective of their HIV status, should be included. When completing the form, ensure that writing a nice and legible writing for the text, as well as placing an X in the appropriate boxes. So please do not use scribbles or ticks. Remember, irrespective of whether someone agrees to participate, we do need to ask the 5 baseline questions, which are regarding age, marital status, visit type, and race, and it must be asked of all eligible women. So that's 15 to 49 years old who are pregnant. Be sure to check that the consent is correctly conducted. That means the consent box is checked and a signature is present for the participant. It is also important to make sure that the nurse interviewing the participant has also noted their name before proceeding to the questions on the next page. So for those who are participating, a blood sample will be taken. So we'll cover the sample handling of this sample. So quite straightforward. A separate tube of blood is taken using the 8.5 ml PPT tube that was provided to you in the kit. This is a separate tube from routine bloods. So remember, the participant may also be having routine bloods taken on that day. It is important to make sure that the tube is filled as much as possible So there is a line that says fill to here. Make sure that the blood is filled all the way up to that line. At the bottom of the survey form were survey barcodes. Please make sure that the first barcode of this is placed lengthwise on the blood tube. The blood tube is then placed in the specimen bag. These are provided in the kit. Make sure that it's placed in the main pocket that has a double zip. You then place the green NHLS laboratory sticker provided in the kit on the outside of the specimen bag. You will see that this has the address information of the NHLS laboratory that the sample needs to be sent to. We then fold the survey collection form in half and place in the side sleeve of the specimen bag. It may be necessary to fold it again to make sure that it's fitting completely within the pouch on the side of the specimen bag. Do not place the survey form directly in the bag with the specimen itself, as if the specimen leaks, there will be blood then on the form. So make sure to use the special sleeve on the side of the specimen bag, which is designed for the survey form. The sample must then be sent with the courier to the NHLS lab within 24 hours. So just to recap on those barcodes, remember to apply the barcode lengthwise and do not wrap it around the tube. This is because in the lab they will scan that barcode with a scanner, and the scanners cannot read around the curved surface. That's why it needs to be lengthwise. You'll see that there are 6 study barcodes provided at the bottom of the front page of the form, and remember to use these barcodes very specifically. The first barcode is used for the PPT tube. The second barcode is placed on the outside of the participant's folder for their medical record, and this will indicate that they have taken part in the survey. So remember, to avoid a re-enrollment, you will be checking whether this barcode is present on the patient medical record, but also to verbally check if they've already taken part. There's also a third barcode that is meant for the clinic logbook, which we'll look at the use of during participant tracking. The bottom row of labels is used for the laboratory only, so please do not use these for any other use. Make sure you only use the top 3 stickers. A reminder about the sample timeframes. The samples must be sent daily with your routine courier to the NHLS laboratory to make sure that integrity is maintained. Remember, it takes a few days for it to get all the way to the NICD, so the sooner you are able to send it with the courier to the lab, the sooner the lab is able to ship it to Johannesburg, and a better chance that the integrity of the sample will be maintained. If you are at a very remote clinic, you need to make sure you coordinate taking of samples very well with the courier schedules. So if your courier is only going to be coming a few days later, make sure you do not collect samples. For example, if the courier has already come on a Friday, do not collect any additional samples that day, because you will need to wait until the Monday for the courier to come again. If it is the case that the sample needs to be kept overnight, please make sure that they are kept in a fridge at the clinic, and must make sure that this is a fridge and not a freezer. Please avoid keeping the samples over the weekend. If there is no courier, do not collect a sample for that Friday. So the courier to the laboratory, the participant pack consisting of the PPT tube and the completed survey must be delivered to the nearest laboratory within 24 hours. Remember not to freeze the samples, but they can be kept in the fridge until they are collected. And the samples are sent with the routine courier service. There are several hub labs that will be receiving your samples. So if you're in the Eastern Cape, it is the Mthatha NHLS laboratory. If you're in the Free State, this is the Universitas NHLS laboratory. In Gauteng, the samples will be going directly to the NICD. In KZN, the samples will go to the Nkosi Albert Luthuli Central Hospital NHLS. In Limpopo, this will be the DGM Academic Laboratory NHLS. In Mpumalanga, the Rob Ferreira NHLS. In the Northern Cape, the majority of samples will be going to the Kimberley Hospital NHLS, but we know from previous surveys that some of those samples do make it to the Free State site, and some do get sent to the Western Cape site, so that is Groote Schuur. But your couriers do know where that they are going. For the Northwest, samples will be sent to Klerksdorp, and as mentioned in Western Cape, the NHLS hub is Groote Schuur. So just to recap on important points regarding sample handling, when you are placing the sample in the bag, make sure that the barcode on the specimen matches the survey form that you place in the outside pouch. Ensure the specimen tube is completely filled when you draw blood, so that must be 8.5 ml of blood. Only one specimen with the accompanying form may be placed into each of the specimen bags. We have provided you with sufficient bags that you should not need to add more than one specimen. Do not use staples or sellotape to bundle the samples together. We have provided you with a Ziploc to keep all of your specimen bags together. You do not need to separate the sample and the form if you need to put them in the fridge. The survey form paper is quite thick, so it will withstand some moisture. And a reminder that all specimens must be sent to an NHLS laboratory as soon as possible and within 24 hours. For participant tracking, we have provided you with a logbook. This is a paper-based register that you will be keeping on site. So remember, this stays on site. You do not send it with the specimens. You need to ensure that your clinic logbook is kept securely, and this is used to track the participants both who enroll or refuse to take part in the survey. You'll see the information that we are recording. So on the clinic logbook, there is a study name. We will be recording patient details as well as the linkage to the barcode and contact numbers. So this is what the clinic logbook looks like. It's got the title of the survey. It says clinic logbook. There is then also a box that indicates which district your facility is in, the facility's name, the facility code. Now remember, this is the NHLS code, not the DHIS code. We have also provided you with the site target for the survey in this clinic logbook. So each of your clinic logbooks are specific for your site, and they've been pre-populated with all this information. So if you see a site target of 10, this means you need to have 10 completely fully enrolled people. This target does not include refusals. It is only for fully enrolled participants. In the register itself, you will see there is a column that is for the date for enrollment, the patient details. So this can be their patient sticker, or you can just write their full name. In the third column, we will place the barcode. So that's the third barcode on the form itself. That sticker is placed in that block. We will then record the contact numbers. Ideally, this should be the contact number of the participant themselves. However, if they do not have a contact number, you can record the contact number they provide of a family member or a partner, but please make sure to note that this is not their personal number, but it is a shared number. The last column we note, is this a refusal or an enrollment? So for reaching sample target, each province has been provided with a list of all of the sites. So that is the provincial coordinators and with the respective targets. We have also noted these targets on the cover of your clinical logbooks as just noted, as well as you will see the sticker on the form pads that are specific to your site. The target is also noted there. The provincial coordinators will make sure that the sites are on track for meeting the targets. The project management team will also track the progress with reaching sample targets closely and provide the information on a regular basis to the district and sub-district coordinators. The site must continue collecting samples until the coordinators communicate to the site that they've successfully reached their targets. So you may overshoot your target a bit, but that is acceptable. Each sample target has been calculated carefully to represent the population that is serviced by that clinic. So if the clinic is not making their target, it is not possible to simply recruit more participants at another clinic. This needs to first be discussed with the NICD epidemiologist to ensure that there is accurate representation. We do understand that populations change and that there is movement and that it might not be possible to meet the targets. So it should be communicated where you're noting that it won't be possible to meet the targets. We also know, especially for the mobile clinics that go out to communities, that they already know who all they will be visiting in the next few weeks, and it is possible that based on these appointments they will not be able to meet the target. Please just make sure that this is communicated to the team. We will be having a dashboard this year where you can actually log in and check how your site is doing. So this will not just be for the provincial and district coordinators checking up on the targets, but you will also be able to track yourselves. We'll be sharing the link once we have some of the information that this goes live. At the moment, we only have the shell of the dashboard, so as information comes live, we will be able to share the link with you. So we can see also on the graph that is displayed on the screen, this is the enrollment pace from the previous survey, and we do know that during the first 2 weeks of enrollment, nearly 60% of our target is met. So even if you're starting slightly late with your data collection, this should be fine because we know that within the 6-week period you should be able to make your target. But you will be able to monitor this going forward using the dashboard. We will look at the procedures now for discrepant results. So we know that there may be discrepant results that come out as part of the study. So discrepant routine rapid tests and HIV ELISA results will be managed per the national guidelines for resolving repeat discrepant results. Participants who tested positive during the routine rapid test with an HIV negative result in the antenatal survey or vice versa will be told that the HIV test performed as part of the survey has a different result from the test result they received during their routine care. The HIV ELISA will be repeated and participants will be notified of the results. Retesting for discrepant cases will be handled on a case-by-case basis in line with the national guidelines. The district specialist team, so National Department of Health employees, will provide guidance on how to handle the discrepant results. The provincial survey coordinators will be responsible for liaising with the laboratory staff to resolve inquiries related to discrepant results. So this concludes the main part about the survey, and we will now just cover data quality and some of the issues that arise as part of the survey. So it's important to know why we collect this data to understand why it's important that it's of high quality. Well, the main reason survey data is collected is to make decisions that will positively impact the success of our country's health system, and in specific for this survey, it's related to HIV. Results from surveys are used by governments to improve policies and procedures. Therefore, the data will help to predict who may contract HIV in the future, understand who is contracting HIV and what services are needed, and improving our nursing and lab practices. Effective decision making all starts with the collecting of data. The healthcare worker plays a key role in this. This is why it's important to understand what good data quality is. So if we look at the data collection value chain, we see that the healthcare worker collects the data from the participant. The data is then captured at the labs, including the laboratory results. Our researchers then analyze the data and generate a report. This report is then provided to decision makers, and decisions are made based on the information provided in the report. So if we look at the components and the outputs of quality data, in order for data to be of high quality, it needs to be complete. That means there is no gaps in the data. It needs to be timely, so it is received at the expected time. So in this case, we have a 6-week time period in which data should be collected. It needs to be consistent, so the same survey is used and the correct version is used to capture the data. It needs to be valid. That means it is in the correct format, type, and within the expected ranges. and it needs to be accurate. This means correct, relevant, exact. If these components are met, we will then have high quality data that is used for informed decision making. So if it is high quality, this will have reduced risk and increased confidence of informed decision making. We'll have improved targeting, so accurate determination of targets, audience, as well as accurate products and services provided. Effective campaigns means there is improved content, improved client engagement. And lastly, easier implementation. That means more efficient analysis and reporting, as well as faster turnaround time for reporting. In order to have high quality data, we employ quality control. Quality control identifies the required responses or actions necessary to correct faulty data collection practices and minimize future occurrences. Examples of data collection problems requiring prompt action include errors in individual data items, systematic errors, violation of the protocol, problems with individual staff or site performance, and lastly, fraud or scientific misconduct. Detecting or monitoring is key to quality control and include the following activities: direct observation during site visits, conference calls and/or face-to-face meetings, regular and frequent reviews of data reports to identify inconsistencies, extreme values, or invalid codes. Quality control activities, so that's detection, monitoring, and action, often occur during as well as after data collection, and the details are always carefully documented. Another component of data quality is data quality standards. So these are used to determine which data to keep, which to correct, and which to get rid of. This ensures consistency across the survey. Data collectors need to ensure they follow the survey instructions so that we can keep as much data as possible. So when a form is complete and correctly completed and filled in, we then keep the data. If one or two items are missing, but we can source them from the patient file, we are then able to correct the data. However, if several questions are unanswered and the survey form is not linked with the blood specimen, we then need to discard the information. So some of the common quality issues we've seen in the previous surveys. First is the specimens are queried without the survey forms, or forms are lost during transfer. We also see participant information sheets and the clinic logbooks being sent with the participant samples. Remember, the information sheets should be provided to the participant and they keep it to take home with them. There is important information they may need on that form. And the clinic logbooks need to stay on site in case we need you to reach out to a participant regarding discrepant results, and that is the only way you will be able to trace them back. A big problem is where consent is not signed by the participant, the nurse, or both. The nurse's name is not written on the consent section. The agree to participate box has not been checked for consent, in which case we cannot use the information that is recorded, even if they had agreed to participate. Survey forms being incomplete, so a lot of question responses being missed. Marking outside of the boxes. The scanner can't then read these responses and we need to manually capture these forms. There's data inconsistencies, so for example, participant reported to be HIV negative, but then a viral load is reported. Refusals not documented, or they are being discarded by the laboratory. And then we have quite a challenge with the misuse of the participant and shipping labels being placed on the form. So as an example, here is where X has been indicated yes for consent for storage of the specimen. However, the participant's signature is missing, in which case we would have to conclude that it is a refusal. And then another example which looks at inconsistency. If we look at this form, G1 has indicated that the participant has not tested for HIV before this pregnancy, that the woman was negative as the previous ANC visit, which is indicated in G2, but then that the participant tested positive today. So for G3, the response was tested positive today. However, when we look at G4, the answer indicates that the woman initiated ARVs at a prior antenatal visit and is already on a second-line regimen as answered in G5. But this is inconsistent. If they'd only tested positive today, they would not have started treatment at a prior visit. And if they'd only started treatment recently, it is not likely that they would be on a second-line regimen. So this could be from a nurse not knowing how to complete the form. It could also be a participant who is confused and is giving the inaccurate information. But this also could be an indication that there is fraud and that the forms are being completed just to have the target met. And we discourage this because if you don't meet target because you don't have sufficient participants, we understand that. So please make sure that the forms are accurately and honestly completed. We also just look at what to do and what not to do, and this is mainly related to the labels. So there are the barcode labels that are provided at the bottom of the participant's form, and there are also the green address labels. So please don't place the barcode labels anywhere else on the survey form. We already have all the barcodes we need hard-coded and printed on the form already. So please do not take the barcode labels from the bottom of the form and then place them anywhere else on the survey form. Challenges that we have is that barcode labels are placed over the facility barcode, or they're placed in the block where the laboratory will be placing their label. So please do not do this. There are only 3 uses for those barcode labels. One is to be placed on the sample tube, one to be placed on the patient file, and one is for the clinic logbook. If you follow these instructions, you will not have the issue where all the barcodes are used. If we receive a form that has no barcodes on it, this creates challenges for the laboratory because they were going to use those labels. So they need to print new labels for their purposes. So please make sure that you do only use the first 3 barcodes as directed above. We have also had challenges previously with the green address labels being placed on the survey form. This is not needed, and it also covers a lot of the information we do need to capture. So please make sure that you use the green label correctly, and that is by placing it on the outside of the specimen bag. So that concludes the training for today. Thank you so much for making time to learn about the survey to ensure that you can conduct the processes correctly. We have a research hotline which you can contact should you have any follow-up questions. So you can either add the number that is here on the slide, or you can scan the QR code to add us as a contact. So please do let us know if you have any questions going forward. And thank you once again for listening to our training.